This is the one surgery tennis players should never have. Of course, I'm talking about anything that lengthens your Achilles tendon, whether being an Achilles tendon lengthening or what's called a gastrocnemius recession. Now, if you look at any well-published study, you'll see that plantar fasciitis and Achilles tendonitis are some of the major injuries and chronic ailments that tennis players suffer from. And one of the main treatments for that, if you failed all the conservative care, is an Achilles tendon lengthening or a gastrocnemius recession. So why shouldn't you have it done? So have you ever watched a tennis serve? Have you ever seen someone push off on a forehand or a backhand, tried to go after a high volley or even a low one? What is going on? You are using your Achilles to explode forward, especially with a serve. Also, if you are playing somebody that has a good serve and you need a good return of serve to be quick off the ball, you're never going to be as quick after you've had that Achilles lengthened because you just can't generate that kind of tendon muscle function, that explosive movement that you were before. Why do people tell you to stretch? Is stretching okay? Well, of course, stretching is fine. The muscle is staying at its physiologic length, right? When you have surgery, you are cutting and physically moving the tendon down or allowing the muscle to slide down. You're changing its physiologic length. With stretching, you're just getting the muscle and tendon fibers to stretch out more, right? The muscle and tendon is still at its same physiologic length. The origin of it and the insertion of it are at the same place. Whereas if you have surgery on it, those points move. And that's what changes the function of that myotendinous unit. So if I have chronic Achilles tendonitis or plantar fasciitis, what should I do? I've stretched my Achilles tendon. Maybe if I've had plantar fasciitis, I've had injections, I've worn a night splint, I have orthotics, I've gotten different tennis shoes, I've done everything. What else is there to do? Number one, the first thing you should do if you have plantar fasciitis or Achilles tendonitis is to stretch your hamstrings, not just your Achilles tendon, but your hamstrings. They are the secret culprit to most foot, knee, lower back pain. So if you want to see how to stretch your hamstrings properly, check out the video up above. The next thing is if you are trying to get your Achilles stretched, all right, if you just have tightness that won't go away, get something like a Theragun, something that's going to introduce a little more rapid fire massage into the tendon. That'll also help the muscle and that tendon stretch out better. It might be better than just you trying to stretch it out, and that might give you a little more relief. So that is something also to do non-surgical. Some people even opt to go into a boot for a while. You can always go into a tall boot, right? Fracture boot, walking boot, cam boot, whatever you want to call it. You can go into one of these boots, rest it for 4 weeks. You can still walk, just walk in the boot, right? Rest it, make sure you're icing, and see if you can't calm the inflammation down. Now, the best thing about being in a boot for that long is the boot is going to stretch your Achilles tendon. So you are getting stretch as well as immobilization and an anti-inflammatory component to that boot because it's not allowing the tendon to move and get inflamed. Next, there's always a quasi-surgical option called Prolotherapy. Now, what Prolotherapy is basically injecting local anesthetic and pretty much sugar water into the tendon or the plantar fascial band, right? Now, what this does is it recruits your body to make its own stem cells in that area, right? It basically acts as like scrubbing bubbles for the fascia or the tendon. Now, in my experience, I've seen about 70% results with this. So 70% of people get better, and I see about 70% pain relief after 3 sessions. I do them 2 weeks apart, 3 sessions. There's also dry needling, which is like a cousin of prolotherapy. I haven't had really any experience with it, but I do know some physical therapists that are using it, and there are a plethora of videos here on YouTube that you can look up to see if it's right for you. I personally would prefer prolotherapy to get that immune response, that immune stimulation. But if you are interested in dry needling, there are also videos on this all over YouTube. If you're interested in PRP injections, just remember that a lot of high-level studies that have come out that have compared PRP to prolotherapy have showed that there isn't much difference. And in patients that get PRP, which is platelet-rich plasma, injected at the time of surgery, there has really never been a connection that has stated the PRP is doing anything. It's really just the surgery that's doing it. And a lot of times when patients are having PRP injected into the tendon or the fascia, what some experts are saying is that the PRP isn't what's making them better, it's the needling of the tendon. So it's that motion of needling, dry needling like we said before, or prolotherapy with the local anesthetic and sugar water is doing the same thing, and it's a whole lot less expensive. And last but not least, what can you do? Well, surgery. Just not a lengthening surgery. You can have your plantar fascia lengthened, which is what's called a plantar fasciotomy, which is where you just slit it, right? And typically on a plantar fasciotomy, unless your entire plantar fascia is involved in your plantar fasciitis, which an MRI or an ultrasound will tell you, you don't have to cut the whole thing. So you still keep its function. Right? You can have Achilles tendon surgery, which is typically a debridement, right? Getting rid of any excess bone or scar tissue or inflammatory tissue or diseased tendon. You just don't lengthen it. So when you go and see your surgeon, just say, I want it cleaned up. I just don't want the lengthening. Now, after this surgery, you will need to stretch for the rest of your life. You will need to develop a stretching regimen for your Achilles and your hamstrings forever. That's it. That's what you're doing. But you will still keep the function of that tendon. All right, everybody, I hope you got something out of this. If you like these videos, please hit the subscribe button below so you're the first to get all of this tennis medicine and sports medicine content delivered right to you. See you later.